Today I'll be performing a blood draw on the cephalic vein of Nala here. So I'll have my coworker hold off the leg. And I'll go ahead and feel for the vein. And I'll stabilize it with my thumb, spray some alcohol in there to sanitize the area. And then I'll have my needle bevel up. And I'll go ahead and draw back. And once you have the desired amount of blood in your syringe, you can go ahead and come out, and then I'll have my coworker hold off. Today I'll be performing a coagulation test. I'll be doing the prothromboblastin clotting time test using the IDEXX Coag DX analyzer. This will evaluate the intrinsic clotting factors and the common clotting factors. This analyzer also can perform the prothrombin time test as well. So I have my PTT cartridge that has been sitting out for about an hour to be room temperature, and I also have 3 mLs of freshly drawn blood in a blue top that has the sodium citrate anticoagulant in it. So, to open this, and the patient's already on the machine as well, so you insert the cartridge. Okay, and it's telling me to add the sample. Take a pipette, and you want to make sure that the blood volume doesn't come too far over. I think I'm going to take a little bit off. Okay. Perfect. Okay, I'll go ahead and press start. Okay, so then we have the result. I'm going to take out the cartridge, and if you look up here, you can view, and it's within the normal range. I'm going to be making a blood slide today, and there's a couple different ways you can do this. I'm going to be using some blood in my syringe and drop a small amount onto the slide. Then you take your other slide, come up to the edge, blood bubble, and then you're going to slowly bring it across. And as you can see, there's the feathered edge. This is where you're going to want to read the blood slide, and this is where it's more concentrated. So then you can wave it to help dry it. You can also use cotton tipped applicators, the ends of them, and get the blood droplet from inside the blood tube. I just had some in my syringe that I used. And then once it's dry, you'll want to stain it. Typically with blood slides, you'll want to submerge the slide for 5 to 10 seconds in each stain. rinse off the back of the slide. And then to allow the slide to dry, you tilt it up with the feathered edge facing up. So now that my slide is dry, I'm going to go ahead and briefly read it. So you'll want to focus from the 10x all the way up until the immersion oil.
That's fine, yeah, I mean, I can call that too. I'm just trying to get an idea because I know we're on crunch time and then,
Okay.
yep.
Then I have my immersion oil here. I'm just going to put a small drop directly onto the lens. Place that. And I'm going to go over to my feathered, find my feathered edge and then make my way back to the counting area. I'll be performing a blood chemistry test, which we're going to be running a pre-anesthetic profile, which includes liver and kidney values, electrolytes, also a CBC. So I have freshly spun down serum, and I'm going to pipette some into this cup. So the patient's already on the machine. I'm going to select that. We're going to be running serum. And I have all of my clips here. We're also going to be doing an SDMA, the Life4, which includes the electrolytes, and then the Chem 10, which is all of the liver and kidney values. Place the new sample in there. The Life4 clips go in first. Then I have the Chemistry 10 clips. And the SDMA comes with also this, so I'm going to open up in here and place that in there. And the SDMA clip goes on top. I'm going to go ahead and press run. Okay, and now we have the results from the chemistry. You can see that everything is within the normal reference range. So today I'll be performing an ELISA test. I'm going to be using a CPL, which is a canine pancreatic lipase test. This determines the levels of the pancreas-specific lipase in the canine serum. So I have my freshly spun down serum, and you do 3 drops. Then 4 drops of the conjugate. And you mix it, and this test has been sitting out for the appropriate amount of time to bring it up to room temperature. So, you'll dump the contents of the tube in there, and then you wait until it reaches this window, and then you'll snap it down and wait for the 10 minutes to read the results. If abnormal results, that would point to the patient having pancreatitis. Also, depending if what kind of ELISA test you're using, this one specifically needs serum, but you can also use whole blood and plasma as well. tap that down, then wait for the 10 minutes, and then we will read the results. So it's been the 10 minutes waiting, and as you can see, compared to the guide they show us, we did get normal results.
Right.
So I'll be performing the Paxil volume, and I have out my microhematocrit tubes, and I have some blood left in my syringe. You can also fill the tubes directly from the purple top with the EDTA anticoagulant. So what you want to do is fill each tube evenly. So I'll go ahead and fill it all the way. And then I will seal one end with clay. Leave that in there. Fill my other one. Seal this one. So each one has an end of clay. And I'm going to be placing them in the StatSpin container, which will go into the microhematocrit centrifuge with the sealed clay ends facing outward. And you can see that it's evenly balanced. And it's on the microhematocrit setting. I'll just go ahead and spin it. So now that the microhematocrit tubes have been spun down, you can easily see this is where the red blood cells are, the buffy coat layer, which contains the platelets and white blood cells, and then the plasma layer, and you can see the bubble of where it ends. So now, to read them, you match where the plasma layer ends with where the red blood cells end, and then match up, which is, and I'm finding 58. And same here, looks like about 58 as well. And if you find that you have a lower than normal value, dehydration can be a factor that affects the PCV and the total solids test. So I'll be performing the total protein or total solids test, and you can take the plasma from the PCV tube that we've already spun down, and I've already broken it. And what you can do this a couple different ways, sometimes using a syringe and a needle can kind of help get the plasma out. And then you hold it up to the light to read what the total protein is, and I am getting 9.